This meeting is being recorded.
Welcome to this mental coronavirus question and answer session, and thank you for joining us today. The contents of this webinar do not purport to provide any financial, investment or professional advice, and nothing in the content of this webinar shall be deemed to constitute the provision of financial, investment or other professional advice in any way. This week is Mental Health Awareness Week, and we felt it was the right time to combine the challenges of returning to work with the impact on everybody's mental health and how best to approach these areas. I'm Helen Easton, and I'm joined today by three of the mental specialists, Nick Sorrett and Edwina Redhead for Employment Law, and Pete Nichols for Health and Safety. All participants are on listen-only mode, but there is an option to ask questions via the Q&A button within the Zoom app. We do try to answer as many questions as we can during these weekly sessions, but we do use all of your questions anyway to update our FAQs within the coronavirus area on Mentor Live. The first question I have to ask this week is for Nick from an employment law perspective. Talk to us about the announcements this week and around what symptoms we need to be looking out for.
Yes, thanks, Helen. Thanks everyone for joining the webinar today. Yes, there has been an announcement earlier this week where they have added an additional symptom that people should look out for. And this is either a loss of or a change to the sense of taste and or the sense of smell. That symptom of coronavirus has been added to the previous list, which contained two tests. One was a new continuous cough and the other was a high temperature. So loss of taste or smell has been added to that as a symptom of coronavirus.
Thanks, Nick. And talk to us about the latest position on testing, would you?
Yes, well, there's other good news here on testing. And that is that basically anyone aged 5 and over who has symptoms of coronavirus can apply for a test. Now, this is what's called an antigen test. It tells you if you currently have the virus. So you need to have the symptoms in the first place, and then you need to test within the first 5 days of having those symptoms. Now, as I understand it, priority is being given on those tests for people in hospital, for NHS and social care staff, but potentially anyone can apply for that test. Now, this is quite important because you'll remember that the advice remains that people with symptoms should self-isolate for at least 7 days. And those who live in the same household as someone with symptoms should self-isolate and remain away from work for 14 days. So it's clearly quite important that if the person with the symptoms has the test, that they understand whether they've actually got COVID or something else, because that would impact on other people living in the household who might then not need to isolate for quite so long. There is another type of test which isn't currently available to say whether you've already had the virus. Pete, I don't know if you have any thoughts on that at all.
Thanks, Nick. Yeah, just to follow up on that. So care homes in England, this is England only, can apply for the test as well. And this would be for residents and staff. And these, they don't have to be symptomatic as well. So that's anyone that works or is a resident in an English care home can apply for the test and have the test done whether they've got symptoms or not. That does actually only apply to care homes for older people and for those with dementia. So it wouldn't be for sort of care homes for younger people. But that's worth noting.
Thanks, Pete. Nick or Pete, from a health and safety perspective, any news on which sectors should be preparing for lockdown easing?
Okay, there has been some news on that this week, and obviously there was some news on that last week. Essentially, there are slightly different plans in place depending on whether you're in England, Scotland or Wales, but actually broadly they run along similar lines. The common factor in all this is that people who are able to work from home should work from home. So those workplaces, like offices, really are unlikely to be permitted to reopen if people can work from home. England published its plan back on the 11th of May last week, and it applies from Wednesday. And essentially, the change is that garden centres are allowed to reopen, together with estate agents. The plan in England is that from the 1st of June at the earliest, some non-essential retail will be allowed to open. Non-essential retail, of course, now is ordered to close by law. So it's that's the next key stage. But the government hasn't yet published details of how they'll phase that. They promised to phase that in. In Wales, really, the guidance very much mirrors the English guidance. Work from home where possible, and garden centres are allowed to reopen. There's no further news on whether they're going to follow England on the 1st of June with the non-essential retail. And finally, in Scotland, the Scottish Government announced its plan yesterday, which again was to work from home where possible. But the key date there is the 28th of May, when garden centres may reopen, and also non-essential outdoor workplaces. And apparently the Scottish Government is planning to publish some guidance on what is a non-essential outdoor workplace. Construction can also reopen in Scotland from Thursday, whereas in England it's permitted now. So that's really the immediate position. And other than that announcement in Scotland, there's no change since last week. Pete, did you have something to say on that?
Yeah, I was just going to highlight that. I mean, this is looking ahead a little bit now, but the UK government, their step 3 of their plan, which provisionally they're dating as being the 4th of July, although obviously that's going to be dependent on current conditions and the R factor and that type of thing. But at the earliest on the 4th of July, then the ambition for the UK government is that hairdressers and beauty salons, that type of establishment, will be opening. Hospitality, such as restaurants, pubs, hotels, accommodation, and public places such as places of worship and leisure facilities and cinemas. I mean, again, the caveat to that is that that's looking ahead to the 4th of July. That's the earliest, and that certainly isn't a date set in stone. Really, it's an ambition depending on government, on what's happening really out there. And that's the UK government position. So Scotland and Wales, won't necessarily follow that date and that exact timeline. So just that's the heads up really.
Thanks, Pete. And am I right in thinking that actually, ultimately, it's a business owner's decision whether or not they reopen, even if the government has said it's okay to do so?
Well, yes, it is the business owner's decision. So just because the government has said that a certain sector may reopen on the 1st of June, that doesn't mean the sector has to reopen on the 1st of June. But businesses do have to bear in mind the requirements that jobs that can be done from home must be done from home where that's possible, and that certain sectors and premises have been ordered by law to close. So non-essential retail has been ordered by law to close, so it can't choose to reopen sooner than the government releasing the lockdown. And of course, any reopening, of course, is subject to the business being able to operate safely. And again, I think, Pete, you may have a view on how that would work.
Yes, there's going to be an onus there on every business to complete a risk assessment. That's very clearly stated in the government guidance and in the new sort of working safely guide that they've issued for various sectors. So it needn't be a particularly complex thing to do, but the guidance is there. There's plenty of information, and it would be wise to have a look at that guidance and to look at what your trade bodies, your professional bodies are saying as well, and just get a range of views on this and start planning early, because lots of businesses that have been permitted to have been open through the pandemic and they've operated very successfully. So it's a case of just getting in there early, making a start, and making sure you involve your staff, and that will be important. Consultation is a key is a key theme in this guidance particularly.
Thanks, Pete. I mean, my next question is going to be around, you know, how do I best get my business and staff ready for coming back to work? So if you can give us some guidance, and then perhaps we can go to Edwina and talk about the employment law side of things.
Absolutely. It's a little bit of a follow-on really from the previous question. So again, it's a case of downloading the relevant government guidance. There's 8 different documents actually. So your business might cut across different documents. There's one, for instance, for agriculture and construction lumped into one. So that might be the relevant one. There's one for vehicles. There's one for sort of offices and that type of establishment. So have a look at the guidance. Start early, start thinking about the sort of risk controls that you could practically do, and speak to your staff at an early age. You know, again, use a wide range of resources. I mean, there's no reason why you can't start planning this, you know, using video conferencing with staff. You know, you can do a certain amount of sort of calls with them and training and planning towards coming back to work. So, you know, it's just make an early start and involve your workforce. That would be important.
I think just to add on to that from a people perspective, it's really communicating obviously all of the safety procedures that you're adopting, but also what you're expecting from people when they do return to work, because the objectives or the focus may have shifted slightly. So really helping to bring people into that at quite an early stage, so that when people are returning to work, they know exactly what they're coming back to and what they'll need to work on. So I think, you know, really over communicating on that is going to be important. And I think just another kind of thing that's worth mentioning is there are a series of return to work checklists available on Mentor Live. So if you are considering reopening your business, then we strongly suggest that you check that out, because that can be quite useful.
Thanks, Edwina. Pete, I'm going to come back to you, and you know I'm going to ask this question about PPE. So come on, give us some guidance on what we should be doing with that.
Yes, indeed. PPE is one of those words that has become to the fore really in the last few weeks. So I think a lot of people are stressing about it a little bit, but essentially it's a reasonably simple message, to be honest, because those people that would normally use PPE, such as gloves, masks, aprons, that type of thing in their normal work, they'll carry on wearing them anyway when they come back to work again. So you'll still need to wear that PPE. In terms of personal protective equipment for preventing the spread of coronavirus, then it's not featuring as a risk control in the government guidance. They're at great pains to not really go down that route, to be honest, because for obvious reasons we don't want to have a shortage of PPE out there. It's already a little bit short. So PPE should always be seen as a last resort, if you like, in risk controls. And the focus here in terms of preventing the spread of coronavirus is going to be what the same controls that we've talked about all along on these webinars, which is social distancing, keeping 2 meters apart at least from people, frequent hand washing, and regular cleaning and hygiene of surfaces and things that you come into contact. They will be the main risk controls, and maybe alongside other things such as barriers and that type of thing. But certainly a lot of people won't need to wear PPE other than what they normally wear.
Okay, thank you for that. I've just had a question come in actually, and I know we've covered it on a previous webinar, but I think it's worth reiterating. Can you give us the guidelines for risk assessments and what people have to do if they've got more than 50 employees, Pete?
Yes, indeed. So normally in health and safety law, every business is required to assess the risks to their employees and anyone who may be affected by their business operations, so visitors, staff, customers, that type of thing. Specifically mentioned in the new government guidance, there's a requirement for everyone to complete a COVID risk assessment before they go back to work. But actually, this is quite new. For those businesses that employ more than 50 employees, there's an indication in the guidance that people should actually publicise their risk assessment, perhaps put it onto their website. In either case, there's a COVID secure poster, it's called, that you can download from the government website, and that should be displayed in every workplace anyway. So there's a requirement there. So that, again, that's something that's quite new to health and safety law, and it's really only come in during the pandemic.
Thanks for answering that one, Pete. We have been asked about when people come back into the workplace, in order to save cleaning down door handles and things like this all the time, is it okay to wedge doors open so that they aren't touched?
Yeah, a few people have mentioned this. I think it's become sort of, a little bit of a hot topic in a way, and it's quite nice to see that the National Fire Chiefs Council have actually produced some guidance around this, specifically for the pandemic, which is great. So actually the guidance is very clear there. Fire doors should never be propped open or wedged open for any reason, because that's to do with the fire integrity of the building. So that shouldn't happen. Certainly in some businesses you will have fire doors that are automatically held open on magnetic catches, things like that, that are part of the fire alarm system. That's fine. But the advice is from the National Fire Chiefs Council is that you'll at least need to clean those doors, the handles and those surfaces where people are touching more often, rather than just hold the doors open.
Okay, thank you. I'm going to hand the panel another hot potato now, because we've had some questions in around temperature testing. We know that some employers are choosing to do temperature testing, and some are relying upon this to reassure both themselves and their staff. And I wondered what the panel's opinions were on that. Who'd like to go first? Pete, shall I come to you first?
Yeah, I'm happy to start off on that one. So I've noted that some bigger companies out there, bigger companies and organisations are using temperature testing for their staff as they've been sort of working through the pandemic. I know others are introducing it as they're opening up again. But in all honesty, I think there are a lot of pitfalls with this. And interestingly, it's not mentioned as one of those control measures in any of the new government working safely guides that have come out in the last couple of weeks. So it's not really going to focus a feature as a main risk control, I think, for most businesses. And I think there are many reasons why you probably ought to avoid it if you can. I mean, I know that there are studies out there to say that it's not a reliable way of testing to see whether someone's got COVID-19, because not everyone has the higher temperature symptoms. For starters, there's an issue around having the right equipment, making sure it's calibrated, and having the right procedure for actually taking those temperature records for staff and what you do with the data. And one of the issues is that I think potentially you could end up sending quite a large number of employees home at the gate in the morning because they've reached the temperature, but they might be perfectly safe to come into work. So it's a little bit of a can of worms, to be honest, on the health and safety side, and I'm sure my colleagues will input on the employment law side as well.
Yes, absolutely. I think it's important to remind ourselves that there isn't a general right for employers to undertake this sort of testing. So employers should tread really carefully from an employment law point of view. I think possibly the closest precedent is alcohol and drugs testing, which applies in some safety critical roles, like people who work on the railways, for example. But in those cases, the contract of employment makes that a condition of their employment. And the testing, of course, is done in accordance with a clear policy and guidance. So it's important to remember that this would count as sensitive personal data under data protection law because it relates to someone's health. So testing must be undertaken in accordance with GDPR. So consent is unlikely to be a fair ground for taking the temperature of an employee, because it might be seen that the consent wasn't given freely, it was given under duress. So I think employers need to think very hard before they put this in place. I think they also need to consider what they're going to do with employees who fail the temperature test. If they're going to send them home, what are you going to do with them? Are you going to pay them full pay because the employee's turned up and they may have no other symptoms and no belief that they're ill? you don't have the right to withhold wages in that situation. You would have to keep the employee on full pay. So I do think employers who are considering introducing this sort of measure must take advice and obviously take heed of what both myself and Peter have said. Edwina, do you have any thoughts on it?
Yeah, I think just to add on to that, I think you almost run the risk that you're falling into a trap that because you've temperature tested, that's a fail safe. Whereas actually we know anyone who has persistent cough or the loss of taste or smell, they should also be isolating as well. So I really don't think this as a sole method is going to be a catch-all. Really, what employers should be looking to do is making sure that all of the government guidance around social distancing and good hygiene practices should be followed. I think that's a much better way to focus on making sure that people's health is put first rather than just relying solely on temperature testing.
Thanks, panel. Let's move on to returning to work and staff who maybe are worried about or refusing to come back into work. Pete, I'll start with you, if I may. What would you advise?
Well, no surprises. I'm probably going to talk about risk assessment and things here, as I usually do. So I think a lot of it is going to be from the health and safety perspective will be built around the risk assessment. So I'm hoping that most employees wouldn't be too concerned about going back if you've set it in the right way. So you've got your risk assessment, you've got your risk controls that you put in place, having sort of consulted the government guidance and the various other sources out there, and you really need to run through this information with your employees nice and early, get their input. Again, I know I've said this before, but get their input at an early stage. And if they're still concerned after you've run through how you're going to be working in the new way, then you just need to dig down a little deeper, really, and just try and work out what their concerns are. Are they worried about coming in on public transport? Are they worried about coming into contact with customers? Is it the fact that they're worried about just generally transmitting the virus back to the families? It's really just getting to the nub of the problem and just seeing if there's anything more you can do to make them feel safer. It might be that they feel like they want to come to work wearing a face covering or something like that. Well, the government are quite supportive of that sort of thing. That might be the type of thing that employees need to sort of get them back into work and to feel comfortable. So it's going to be communicated with employees, really.
Yeah, absolutely. I would absolutely agree with everything that you've said there, Pete. I think a conversation is absolutely the starting point, because there could be some quite legitimate reasons as to why that person is feeling quite worried or anxious about returning to work. Clearly, it's a good opportunity for the employer to communicate all of the safety measures that they have already put into place, but also to understand if there are any other measures that they could implement to help particular individuals feel more at ease about returning to work. And it's best practice to always document that as well. So if you've had those conversations, if you've agreed some action points, then make sure that you've kept a note of that. I think, if somebody is refusing, if they do reasonably believe that they're in, serious or imminent danger of contracting the coronavirus through being at work, then clearly disciplinary action would not be advisable. But if there is no legitimate reason, then it may be possible to take some action. I think really the key is if the situation is becoming quite contentious, then make sure that you're taking some employment law advice, either from ourselves or from another reputable practice.
Thanks, Edwina. Let's talk about the vulnerable and those with disabilities or those who should be shielded. There's two questions here. The one side is, can I as an employer insist that they come into work because we've got work for them to do? Or equally, what if the vulnerable or those that should be shielded are desperate to come back to work and want to come into work anyway? So the two sides. Can the panel give us some guidance on that, please?
Yeah, I'll start off on that one. And we are having questions submitted about this, both on our advice service and on the live feed we've got. Starting point here is that people should work from home if it's possible to do so. So don't forget that when you're sort of ordering people back to work, in inverted commas. It may be that they can work from home, and that should always be the first port of call. The extremely vulnerable have been ordered to shield, and they will have received a letter from the NHS, but actually vulnerability isn't a sort of, there's not a hard cut-off line, although the government has defined extremely vulnerable within this. It's not an exhaustive list that they've given. So there may be people who consider themselves to be extremely vulnerable, or whose GP considers them to be extremely vulnerable, who may not have actually, strictly speaking, received the letter from the NHS. So I think it's really, really important that employers actually maintain a dialogue with their staff and understand what their situation is. I think one of the questions that an employer could be asking is whether the employee has spoken to their GP and what the GP's views and advice may be, because, you know, say they may not come within the extremely vulnerable category, but you know, an employee who's pregnant, for example, may very well feel that actually the public guidance on pregnancy and being vulnerable is not hard and fast, and they may feel that they don't particularly want to go into that workplace, so they may feel that brings them within that category. And I think what I'm getting at here is there is not an easy answer to this question. It's also important to bear in mind disability discrimination law, which of course still applies, and that gives employers an obligation to make reasonable adjustments for people who have a disability. And of course many people who are vulnerable or extremely vulnerable may count as having a disability for that. So again, employers can't really sort of do a hard and fast, you've got to come to work, without considering the need to make reasonable adjustments. I'll try and answer the question about the shielded employee who's demanding to come back to work. And I think that possibly this does have more of a sort of health and safety angle. I think an employer does have a duty to look after an employee's health and safety, and someone who is classed as extremely vulnerable is demanding to come into the workplace. Well, I think it would very much depend what the workplace was like. You know, it may be that you know, meeting lots of people in a supermarket would not be at all appropriate, but there may be other jobs where it's more appropriate. Pete, I don't know if you have any views about someone extremely vulnerable being, you know, wanting to come back to work.
I do, and I think, yes, absolutely. If you have got someone in that sort of category that really does want to come down to work, come back to work, then it is going to come down to the risk assessment that employer does. So, as you said, if someone can work in a low risk environment, you know, they might be working on their own in an office, they're not coming into contact with any public, that they're driving to work, they're not on public transport, then, you know, the risks are very, very low. And there's, on the face of it, if you can justify it in your risk assessment, then there's no reason why they shouldn't come back to work if they really need to. But the guidance is that they should still be at home. But again, any other situation than that, where you're possibly coming into contact with other staff, possibly, you know, less than 2 meters distance from people, or you're public facing, then, you know, the risks are going to be quite considerable for that type of person, and it would just outweigh it. It would the benefit of being work, to me, would outweigh the risks, honestly. But it's going to come down to an individual risk assessment at the end of the day.
Thanks, Pete. Question we have been asked this morning is, can we as employers be sued if someone gets COVID-19 at work?
Yes, this is something that a lot of people and professions are sort of debating at the moment, I suppose, and it's understandable. It's really understandable. From a health and safety point of view, I think the terminology here is reasonably practicable. So every employer is required to carry out a reasonably practicable risk assessment to identify the sort of the sort of reasonably obvious risks in the workplace. So I think as long as you've completed that risk assessment, and you've thought about those risk controls, you've followed the guidance, and you've involved your staff and made them aware of it, documented this, then honestly that is the backbone of your defence against either sort of perhaps the HSE coming out and speaking with you or coming to your workplace, or a civil law claim. But the risk assessment is important. Again, if you're wondering where to start from here, we do have a COVID-19 risk assessment example on the Mental Life Hub, which you can download. It's very detailed. You can make a start from that, and that would be quite useful as well. So yeah, I hope that answers the question.
Thanks, Pete. I'm going to jump now to working from home. So a lot of people on the call will have staff who are working from home and who went to work from home on a temporary basis. So I want to ask the panel, if you put an employee working from home on a temporary basis, and now actually as time has gone on, it feels like it's okay that that's something that you can do with your business and your employees more permanently, what are the considerations that we need to take, like risk assessments and equipment and things like that? So give us a bit of an outline of what we need to think about.
Yeah, that's genuinely an interesting question, actually. I'm a home worker, I've worked at home for many years. So the main risk assessment that you'd expect to have for your homework is a DSE risk assessment, display screen equipment. So that's really a risk assessment around your computer, your desk, and your setup. And I think sort of for most people who work in an office, in a building, who've got a PC and a desk or a laptop, it's almost a formality in a lot of cases, because I think most people are quite know how to set up their computer and how to work safely with a computer. The risks aren't particularly high. But I think this is all changing now, and you've got people that are working at home, and it's not really acceptable for someone to be working full time at home at a computer, perhaps on a laptop, sat on a beanbag or on a kitchen stool. It's just not going to be conducive on a long term basis. You could maybe do that for a short period of time, but employers are going to need to look at this. And again, sorry to say it, but it comes down to a risk assessment of that work. There's no actual legalities or law around what equipment you need to provide. So I think from a home worker's point of view, it's not great if you're working long periods of time off a laptop, because you're likely to be sort of hunched over a small screen and you can't really alter your position. So the absolute ideal is you've got a good quality office chair with a height adjustable back, height adjustable seat. And if you're working off a laptop, then ideally you'll have an extra screen plugged into that, a separate keyboard and a separate mouse, and then you can set yourself up properly and at a table as well. That's the ideal. I think a lot of people are going to be looking at somewhere in between that, really. And we can't give everyone a desk, an office chair, a new computer just like that. So we're going to have to sort of find some common ground.
And Nick or Edwina, from an employment law perspective, what are the implications of changing people's terms and conditions like this?
Well, exactly. I just make that point that working from home is a change to people's terms and conditions in many cases. And the employee may not be too happy about that in the longer term. They may want to leave the house. Their house may not be well set up for working from home permanently. They may not find that job is something they actually really signed up for. So it's important not to. I know the public health guidance is very much that work from home for now, because that's what the guidance says. But if that guidance is eased up, employee may prefer to go into an environment that where they have other people around them. So it's really, really important that employers who are wanting to make that change permanently do talk about it to their staff, try and understand whether there are any issues, whether people are going to object, and take advice if necessary. If employees of objecting that you before seeking to impose that sort of change, because you do want people who are working from home to be happy about it. I don't know, Edwina, do you have any thoughts on that?
Yeah, I think just to touch on the point that you've made there around how it potentially affects different people in different ways. There will be some people who are absolutely thriving from working from home, but there will also be lots of people that are struggling, perhaps because their home isn't a great environment to be working from, or perhaps due to childcare or many other reasons why it's not necessarily great for them. So I do think that that's something to consider, that it's not necessarily going to be right for all people. Some people will just thrive from being in an office environment and being able to speak to other people. So that is something to consider. And although working from home might have worked well for a number of weeks, it's still important to think about, actually, would that be sustained, and how can we ensure that people would still collaborate together, and they would still work in an innovative way. You might need to actually review your ways of working and really consider what your digital capability is. So I think there's lots more considerations to make, and just because it's worked well for a short term doesn't necessarily mean that would work on a sustained basis. So I do think the move to permanent working from home does require some thought and consideration.
Yeah, you make some really good points there, Edwina. There have been lots of questions coming in around the 2 metre social distancing rule, and I know this is something that not everybody can actually impose. One of the questions was asking about providing physical barriers in a workplace. So, Pete, I will come to you first. What would your guidance be on that, and what would you suggest?
Yeah, there's plenty of guidance out there for those at the moment. For those people that can't work at home, then coming back into work, I suppose the primarily risk control is keeping apart 2 meters. Then you don't have to have any physical barriers, and if you can mark floors, move desks apart, things like that, that's the ideal. And then your workplace is not going to look too sort of austere and formidable, if you like. But there's plenty of examples of clients I can think of that have been working, the last couple of months through the pandemic, where they've got physical screens up in their shops, at their till points, that type of thing. And I know offices and other establishments are starting to think about screens as well. So it's definitely a risk control measure that you can use. It's highlighted in the guidance. I would just urge a little bit of caution around having too many screens if you don't need them, because it can make the workplace look quite intimidating in a way. But it's a perfectly good risk control.
Edwina, anything you'd like to add to that?
Yeah, I was just going to add on to that. In the same way that we talked about temperature testing and PPE, I don't think that this should be solely what the employer relies on. It's clearly a really good measure, but of course the employer still needs to make sure that they are following the rules around social distancing, trying to minimise interactions as much as possible, making sure there's good hygiene and cleaning procedures. So a good measure, but I think it does need to be looked at in the round with other measures as well.
It's a fair point, thank you. Edwina, I want to come back to you now and ask, we've had a few questions around bereavement and bereavement support. So if you can give us some guidance on how employers can best support their staff, it would be useful.
Yeah, absolutely. And it's really difficult for employees and employers to deal with bereavements, because again, it does affect different people in different ways. I think the key message is to be supportive, make sure that you have got that open dialogue so you can really understand how somebody is feeling. And as an employee, you may want to offer counselling support. You may have that already available if you have some form of employee assistance programme. So that's definitely something to consider. In terms of the right to kind of leave and pay time off, there is only a statutory right to paid bereavement leave if you're a parent and you're losing a child under the age of 18. Other than that, it's really going to depend on what's in your company policy as to what you offer and whether that time is paid or not. I think also that something that employers might just want to be aware of is there are still restrictions on funeral attendance. So employees may need to take some time off at a later point in the year. So if employers can be sensitive to that and accommodate that, again, that would be really helpful. But it's clearly a difficult subject. And again, if there are specific circumstances, would suggest that you take some advice on that.
Seems very reasonable, thank you. And you know what we've been going through over the last 6 to 8 weeks, and I don't propose to use that word unprecedented, but I will. But in order to help people cope with all the changes, not just employees, but also managers, business owners as well, what tips have you got for them?
Yeah, I think there's lots of tips when it comes to, coping with some of those changes. I mean, a starting point might be actually to run some training on this. We're able to facilitate virtually training on topics such as how to handle stress, how to cope with change, and how to build resilience. And again, all of those are really relevant subjects right now, which can help to support staff. I think it's also really important that managers understand that change curve as well, and the fact that people will respond to the changes that are happening around them, the changes that are happening at work in very different ways. And I think really to help people on that journey and to make that as supportive as possible, really clearly communicating what your plans are, particularly if you're thinking about returning to work, making sure that employees really are aware of what that might look like, what you're thinking, when this is likely to take place. That's going to help them to be able to, adapt and really cope with those changes. So getting staff involved with that, communicating at an early stage, keep communicating. I don't think, you can really over communicate in these circumstances. That's going to really, help to support people at this moment in time.
Thank you. And this is a question for both Pete and Edwina, actually. How would you recommend that a business goes around fostering good mental well-being in the workplace? And the secondary part to that question is, do businesses need to have a specific and separate stress risk assessment?
Yeah, so there are requirements around stress. In fact, over 11 million days are lost in the UK due to work-related stress. So it's a huge issue in the workplace anyway. So it's only going to be more prevalent at this time. So there is a requirement certainly for businesses to carry out a stress risk assessment. Some will have done it already. Others, wouldn't really have considered it as being a particular issue, but it might be more so now around stress and well-being. So actually, there's a lot of very good guidance on the HSE website that could be used. There's some example stress risk assessments on there, and a lot of it comes down to talking with staff and just identifying what some of those work factors that might cause stress. And obviously at the moment, with far more people working at home and juggling work along with sort of educating their children at the same time and all these other things and bereavement, then there's more of a need than ever to look at these things. But certainly a stress risk assessment, it's not too difficult to do, and it can be very, very useful.
I think it's also about setting really clear working parameters where there'll be lots of people who are continuing to work from home, making sure that, people aren't necessarily working, excessive hours, they have got the right setup. That really does help to ensure that, people's well-being is being looked after. So make sure that, you have got some guidance in place, whether it's working from home or working, back in the, the office environment when that does happen, so that people really are aware of what's expected of them. That's really going to help to promote positive well-being. Setting really clear objectives as well as to what work needs to be done and how that work needs to be done. And then I think just taking a step outside of the work environment, really making sure that you are promoting self-care and really encouraging employees to make sure that they are they're looking after their nutrition, they're getting enough exercise, they're really trying to focus on, getting that time to relax and getting enough sleep. I know it's all of the obvious things, but those really are the core pillars of well-being, and people do need to make sure that they're really looking after those to ensure they're feeling their best. And I think there are tips on those pillars online. The NHS website Every Mind Matters is really useful. So if somebody is struggling with getting enough sleep at the moment, if they're finding it quite difficult to get out and exercise, there's lots of really useful information on there, and you can generate your own personal wellbeing action plan. And I think from a manager's perspective, that can be a really useful tool that you can signpost staff to that, so that they're really taking on that responsibility of making sure they're looking after their own well-being. So I think lots of things that people can be doing to make sure that they are protecting their well-being at the moment.
Thanks, Edwina. Look, by registering for today's webinar, you will shortly be sent a follow-up email giving useful website links. The panel have mentioned loads of places you can go for more information, but you will also get a link to the Mentor website. And if you click on the Coronavirus Read More button, you can register to use Mentor Live free of charge. I know a lot of people have been asking on the Q&A stream as to whether or not we've got any templates that they can use. And actually, if you go on to Mentor Live, there is a specific coronavirus area where you've got access to loads of frequently asked questions, risk assessment templates, letters, much more. But we also offer a 3-month advice service, which is chargeable. But if you want to know more about any of our services, our contact details are available on the Mentor website. Within Mentor Live in the coronavirus area, you'll find the registration links to our weekly sessions. I will make the comment, we've been asked a number of times this morning on the stream about can people get a recording of this? Yes, it is recorded, and you can find links to that recording within the coronavirus area on Mentor Live, but equally you can find the recordings. They're actually on the NatWest YouTube channel, and you can listen to some of the previous weeks that we've done as well, where many of the questions that have been asked this morning have already been answered. So we, as I say, we do this weekly. Next week we'll do a circle back round again and look again at the job retention scheme and returning to work and the intricacies of furlough, which I know a number of people have been asking this morning. But I'd like to thank our panellists for sharing their knowledge today, and mainly I would like to thank all of you for joining us. Thank you.
The recording has stopped.
Hi, Edwina.